Hi, I'm Mark Davis. I'm a naturopathic doctor and I practice at Capital Integrative Health. My favorite thing to do there is a category of interventions called biotherapeutics, which means using living microorganisms to promote health. There's two main categories I use. The first that I want to talk about in relationship to neurodegenerative diseases like multiple sclerosis is called helminthic therapy. Helminths, 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 are tiny worm-like organisms that live in the guts of all vertebrates, anything with a spine, birds and fish and amphibians and reptiles and all mammals, including humans. The only creatures, the only vertebrates that don't almost universally have helminths living in their guts are humans and the animals that are treated by humans with drugs to get rid of helminths. Cats and our dogs and our cattle and stuff like that. Otherwise, they're everywhere. Now, one of the strategies these helminths have developed to live inside the guts of mammals is to increase immune tolerance. They want our immune system to tolerate them, and so they increase something called T regulatory cells, which tells other parts of the immune system when to calm down. And with MS, it seems like parts of the immune system are going haywire and wreaking havoc on the myelin sheaths of the central nervous system, which causes all sorts of health problems. So the most interesting study I think about MS and helminths comes from this Argentine neurologist, Dr. Corial, who was familiar with this idea of how helminths can increase immune tolerance. And so when there were some economic problems in Argentina that led to some sewage water generally getting into drinking water, more patients were getting helminths by accident. And so Corial said to his multiple sclerosis patients who were getting helminths, what if we just don't treat them? They're actually very easy to treat and get rid of. A single 1 or 2 doses of albendazole or mebendazole, these pretty harmless anti-helminthic drugs, kill off your helminths right away if you want to. But he said, what if we don't treat them? And we allow you to continue with these helminths as long as you're tolerating them well and they're not causing you too much harm. And we see how you do. So we had about a dozen patients who were like, okay, let's just keep the helminths for now. And he compared those to the rest of his MS patients who didn't have helminths for a period of about 5 years. And he followed 2 things. How many flares they were having, how many new and enlarging lesions they were having with and without gadolinium, and what their scale was on something called the Extended Disability Status scale that is a 0 to 10 point scale that tracks how disabled your MS has made you. 0 means there's no symptoms, and as the score goes up, closer to 10, you have increasing levels of disability, problems with walking, needing a cane, needing to be in a wheelchair, being bedbound, and once you're at a 10, that's loss of life. So a lot happens in this 10-point scale. And it's very interesting because compared to the patients with MS had an average of like a couple flares per year, and they had evidence of significant numbers of new and enlarging lesions over 5 years, and then an average change of 2.5 on the Extended Disability Status scale. 2.5 on a 10-point scale that's pretty meaningful. And the patients with helminths had almost no change on the EDSS. Their levels are very close to 0. Almost no new and enlarging lesions with and without gadolinium, and almost no flares in that 5-year period. So huge difference there. And those were humans infected with human helminths. There was one study of using an animal helminth on humans as a medicine for MS patients to try to get benefit. And there was some statistically significant benefit. I'm not remembering the exact degree of it, but it wasn't anything to write home about, not like in Corial's study. So when I have patients with MS, I advocate for them to consider the use of some harmless human helminths. My favorite is Necator americanus, the human hookworm, New World human hookworm. I've used that with dozens of patients, most of whom have inflammatory bowel disease. That's my main patient population. I've used it with family members. I've inoculated myself with Necator americanus twice. I don't even have an autoimmune disease. It's just a lot of people think helminths can be gross. And I thought, hey, if I think they're so safe and not gross that I'm willing to take them, even though I'm not expecting health benefits from them, then maybe that'll help my patients get over the ick factor of a worm therapy that maybe could help their health. So the other biotherapeutic I use is living bacteria from the colons of healthy humans. We call that fecal microbiota transplantation because we're taking the microbiota from feces of healthy humans, we're transplanting it, usually via an enema, into the guts of the sick people. And there are 4 case reports of FMT being used for patients with multiple sclerosis with good benefit, sometimes great benefit. Uh, Including one case report of a 20-something-year-old man whose MS was so severe that he was wheelchair-bound and he had an indwelling urinary catheter. And after fecal transplant, he was able to walk and urinate unaided, dramatic reversal of symptoms. I've used FMT retention enemas with 2 MS patients only, but both of them are cool stories. No dramatic reversals, but neither of them was very far progressed in their disease state, and they didn't continue to progress over the period of years when I followed them. And one of them, as he went back to his neurologist for repeat visits, reported that his neurologist told him that they were unable to find any signs of MS in his brain using MRI anymore. So that's a pretty good outcome. So I like both of these biotherapeutics because they're very, very safe, even though they're super weird. And they're things that I think everybody with MS should learn about and at least consider, doing some reading about and decide along with their medical team if it's appropriate for them.